Eprosartan Mesylate is a medication used to lower high blood pressure, also known as hypertension. By relaxing the blood vessels, it helps to prevent strokes, heart attacks, and kidney problems. Eprosartan Mesylate belongs to a class of drugs called angiotensin receptor blockers, ARBs. It is generally taken once a day, with or without food, and the dosage is determined by your doctor based on your medical condition and response to treatment. It's important to take this medication at the same time each day to get the most benefit. When taking Eprosartan Mesylate, it's important to follow your doctor's instructions on how to take it. You can take it with or without food, usually once or twice a day. It's best to take it at the same time each day to help you remember. The dosage will depend on your medical condition and how you respond to the medication. It may take 2 to 3 weeks before you notice the full benefit of the drug for treating high blood pressure. Even if you start feeling better, it's important to keep taking the medication as prescribed. Many people with high blood pressure don't feel unwell, so it's crucial to continue the treatment. If you notice your condition getting worse, such as an increase in your routine blood pressure readings, be sure to inform your doctor. As with any medication, there may be some side effects when taking Eprosartan Mesylate. These can include dizziness, lightheadedness, and blurred vision. If you experience any of these effects and they persist or worsen, it's important to inform your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. It's important to note that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects, such as fainting, decreased sexual ability, muscle pain, or symptoms of a high potassium blood level, like muscle weakness or a slow or irregular heartbeat. While Eprosartan may be used to prevent or treat kidney problems, it can rarely cause serious kidney problems or exacerbate existing ones. Your doctor will monitor your kidney function while you're taking Eprosartan, and it's important to report any signs of kidney problems, such as a change in the amount of urine. In the rare event of a serious allergic reaction to this drug, seek medical help right away if you notice symptoms such as a rash, itching or swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you are pregnant, planning to become pregnant, or think you may be pregnant, it is important to avoid using Eprosartan Mesylate as it can cause serious harm to an unborn baby. It is crucial to consult your doctor to discuss the use of reliable forms of birth control while taking this medication. If you have any concerns about pregnancy, make sure to contact your doctor immediately. Before taking Eprosartan, it's important to let your doctor know if you have any allergies to this medication or other similar medications. This is because it contains inactive ingredients that could cause allergic reactions or other issues. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have liver disease, high levels of potassium in your blood, or if you are dehydrated. When taking this medication, be cautious about feeling dizzy, especially when consuming alcohol or using marijuana. It's advised not to drive or operate machinery until you feel alert enough to do so. It's also important to limit your alcohol intake and consult your doctor if you are using marijuana. Eprosartan may increase your potassium levels, so it's important to consult your doctor before using potassium supplements or salt substitutes containing potassium. Additionally, if you are planning to have surgery, it's important to inform your doctor about all the medications you are currently taking. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as Eprosartan may harm an unborn baby. It is also unknown if this medication passes into breast milk, so it's crucial to consult your doctor before breastfeeding. It's important to be aware of any potential interactions when taking Eprosartan Mesylate. Certain medications or herbal products may change how it works or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Eprosartan Mesylate include aliskiren, lithium, and drugs that may increase the level of potassium in the blood. It's important to also be cautious of products that could raise your blood pressure or worsen your heart failure. Be sure to talk to your pharmacist about any products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen or naproxen. If someone takes too much Eprosartan Mesylate and has severe symptoms like passing out or trouble breathing, it's important to call 911 or a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. If you're in Canada, you can call a provincial poison control center. Symptoms of an overdose may include an unusually fast or slow heartbeat, severe dizziness, and fainting. If you suspect an overdose, it's crucial to seek immediate medical help. Remember, it's important not to share this medication with others. In addition to taking this medicine, making lifestyle changes such as stress reduction programs, exercise, and dietary changes can help increase its effectiveness. Talk to your doctor or pharmacist about lifestyle changes that might benefit you. While you are taking this medication, it's important to have lab and/or medical tests done, such as kidney function and potassium blood levels. Be sure to keep all medical and lab appointments, and consult your doctor for more details. It's also important to have your blood pressure checked regularly while taking this medication. You can also learn how to monitor your own blood pressure at home, so be sure to discuss this with your doctor. If you happen to forget to take your dose of Eprosartan Mesylate, it's important to take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed dose and take your next one at the regular scheduled time. It's crucial not to take a double dose to make up for the missed one. It's important to stick to the recommended dosage and schedule for this medication to ensure its effectiveness. When storing Eprosartan Mesylate, it's important to keep it at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom and always keep it out of reach of children and pets. If you have unused Eprosartan Mesylate or it has expired, it's important to properly discard it. You should not flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.